Welcome to the Pen Leader Podcast, where strategic leaders get straight to the topics, strengthening our awareness and sharpening our minds. The Pen Leader Podcast is produced by Roar, a production division of Mays & Associates Ltd. Find out more at www.maysassociatesltd.com. Now here is your award-winning host, Dr. Shanda Gore.
And welcome to the Pen Leader Podcast. Today we're going to be talking about healing through leadership. And I have with me today Dr. Patrice Little, who is the Director at Large at United Advanced Practice Registered Nurses of Georgia and the CEO of NP Student, the nation's first platform dedicated to supporting registered nurses transitioning to nurse practitioners. Dr. Little developed the NP Student Boot Camp, a pre-curriculum intensive for newly accepted NPs, and is the publisher of NP Student Magazine, a quarterly publication offering a unique blend of educational and lifestyle content. She's worked in policy. She's served as a senior policy advisor for AARP's Campaign for Action, supporting state UAPRN organizations and navigating policy changes. She holds a doctorate of nursing practice degree from Georgia Baptist College of Nursing of Mercer University. She has a Master of Science in Nursing from Brenau University, a BS degree in Biology and Pre-Medicine and Nursing from Georgia Southwestern State University. She is a member of the Atlanta Association of Black Journalists, the American Association of Nurse Practitioners. I am so glad to have her with me, and welcome, Dr. Little.
Thank you, Dr. Gore, for having me here.
Your resume is so impressive. Tell me about, what you're passionate about and what motivated you to do this.
Yes, there's quite a bit of things I'm extremely passionate about, but for the sake of time, I'll focus on two things. The first thing is just making sure that this next wave of nurse practitioners who are entering the workforce that are overwhelmed by technology, particularly AI and social media, that they are competent nurse practitioners who are able to deliver quality care that's safe and equitable. So that's number one. And number two, making sure, because there's a portion of me that where there's a part of becoming who I am today had to do with a lot of healing of childhood trauma. So making sure that those who feel like they're overlooked and don't have a voice are able to find it and eventually recognize their genius.
So this is why you have a number of platforms here. You have curriculum that you've built, and then you've also have this magazine that has been on a national scale, helping those that are nurse practitioners are wanting to be. Can you talk about that and starting that magazine, that national magazine?
Absolutely. So there's a couple of stories that involve the whole inception of NP Student Magazine, and NP is short for Nurse Practitioner. We launched in 2018 towards the end of me completing my Doctor of Nursing practice at Georgia Baptist. And it was at a time where I was finishing my scholarly project. So in order to have that degree declared, you have to do a quality improvement project. So my focus was on improving the approach to increase access to care for Georgians in the state of Georgia. So in short, just to talk about some statistics, Georgia has one of the lowest healthcare outcomes. Okay. So at that time, I believe we were ranked maybe 42 or 46. So when you're ranked that low, it's so important to realize, well, what's the solution to that problem? Well, the problem was we did not have enough primary care providers. A lot of hospitals were closing. And with that, it would take some people 60 minutes to get to a healthcare provider. So what was the solution, which is still an ongoing solution today, is to have nurse practitioners be able to gain full practice authority. And that means that they would not have a document on file, also called collaborative agreement, where they are able to practice, open up their practices and provide services without being connected to a physician. Now, there's a caveat to this. How can we really promote this when we know that over time, nurse practitioner education has evolved? Years ago, when it came about in 1965 with Dr. Henry Silva and Loretta Ford, it was to address the pediatrician shortage in rural communities. And that's how the nurse practitioner profession came about. But the nurse practitioners were trained by physicians. So they were giving a lot of the insights and rationales of why they do what they do. And then as things transition and the nurse practitioner programs became under the nursing umbrella, as particularly advanced practice, a lot of things changed with it. It ended up where we had to find our preceptors on our own. So if you didn't go to a school like Mercer or Emory, where they find your preceptors for you, and you went to one of the, I call it proprietary schools, but basically schools are just in it mainly for the business, and you had to find your own preceptor, you weren't receiving the same level of training. The general public are not aware that when it comes to nurse practitioner training, it is not standardized. Yes, we have essentials that we, as far as the curriculum that needs to be checked off to satisfy the requirement for graduation to sit for a national board. But when it comes to the training to compare it to our counterparts, who's a physician, it's standardized no matter what medical school you go to. And it's not like that within nurse practitioner school training. So I said quite a bit, but my point is the magazine exists to answer those questions. Like, what is it that every NP student should know? And there's a lot that needs to be known.
You know, I'm so impressed with the fact that you have the magazine going, but you also published author of books that actually try to answer some of these questions too. You have the 2024 book, The Starter Guide to Think Like an NP, a Nurse Practitioner. But can you talk about what the difference would be in thinking as a leader in this field?
Absolutely. One of the things that I reinforce with all the students that I mentor, and then like directly and those indirectly through my platforms, is you always have to start with the end in mind. Before you put yourself out there and try to transition into a leader, you need to already be doing that. So part of becoming is literally doing what you want to be before you become it. And I'm going to share this as far as with the story that I highlight in the Starter Guide to Think Like an NP. I mentioned that in my early stages as a registered nurse, people would come to the hospital and I had patients and their families ask me immediately, are you the nurse practitioner? And I'm like, no, I'm actually your nurse. And they were like, wow, the way you're giving care, none of the other nurses was giving it like that. I was already functioning in that role, making sure my patients, not just their medical needs, but that holistic part. Are you comfortable? Is there a family member that you want to call to have come? You know, we still have visitation hours open. I was tending to just all those aspects of their life. So I say that because who I am, I was trying to duplicate it by helping others with mentorship.
Yes.
And I don't have the capacity. So as far as a human being, so that's why the book exists. It's there to answer everything you need to know before applying to NP school. And the number one question is becoming a nurse practitioner the right fit for you? I've also had nurse practitioner students who I've encouraged to go to become a physician. The things that they wanted was not going to be met and they would have been disappointed. And oftentimes we find individuals who spend 1 to 3 to 5 years in a particular training. And when it's done, they say, this is not what I thought it was going to be. Well, unfortunately, you have to take responsibility for that. You can't get vexed with the actual curriculum, the school, or the profession. This is the part where we reinforce that you have to take the time to vet the schools, learn more about who you are and what you want before you enter the profession. And then of course, the last part is like, okay, yeah, let me help you with applying to NP school, but I want to make sure that you're sure, making an informed decision, because it's a great profession. It's very flexible. You have versatility as far as the types of areas you can work in, and then you get paid really well. But make sure that this is a right fit for you.
I was thinking about what you were saying there concerning those next steps. It sounds like if you are thinking about becoming an NP, you really need to do your research, is what I'm hearing. But
yes.
And would you also recommend talking with someone who's currently an NP?
Absolutely. And that's where I was saying that most of the times people want to talk to me. I'm flattered and I want to serve them, but I'm also one human, like a person. And I have to have, just time for myself so I can deliver service at its highest capacity. And that's why the book exists. I'm answering all of those frequently asked questions like, oh, well, I heard about that school. There's a particular school, and I'm gonna leave it nameless right now, but it's in the book. So please head over to Amazon and read the book. Gotta do that plug, right?
Right.
There's a particular school, literally, that the nurse practitioner students didn't find out until it was almost time to graduate that that program was not accredited.
Oh,
So there's stories that I touch on like that, like the accreditation. What is accreditation? These are things that most people should know and maybe already do. It's just reinforcing it. Like don't do anything different. The same way you made sure that that college was accredited for your BSN or your undergraduate degree, do the same thing for the graduate, do the same thing for the doctorate. So you're still taking the same steps. It's just one of those things where I'm just giving you some stories of things that actually exist if you do not check off that steps. And that is a part of thinking. Your thinking should be strategic. That's what's going to happen as a leader when you're over your practice. And so you should be adopting that thinking when it's time to apply for school.
and I really, that conversation about leadership and taking control of your practice. There's also the element of being a business owner at the same time you're running your practice.
Absolutely.
I wonder about that too. Sometimes strategic planning, I've had individuals who are in the healthcare industry who said, "Well, I didn't go in to be a business major. I went in to help and to serve my patients that come in." And I said, "Well, they're like your clients." And then they said, "Well, I guess you can look at it that way." And I said, "Well, you're running a business. You can't function without having the lights on and having the equipment." And so they say, "Well, what would you suggest?" And I said, "Well, you need to go and do research on how that business runs. You could be the best practitioner, you could be the best doctor, but if you're in private practice, you really need to know those elements and understand how to do it well. And if not, you need to get with someone who can help and assist you in that." And that's, you struck on that important chord, that having a strategic plan on how you want to move forward. How has that informed you and how has that helped you?
It has helped me significantly. And one of the things, Dr. Shanda, is that I revisited one of your podcasts before we went on today. And the talk was, I believe, knowing your blind spots. And it resonated with me so much because many people, they have the passion, right? You have the passion, you may have the capital, and you have the knowledge, but you don't have the plan. And that's why that's so important, in a sense where it wasn't until I had a full strategic plan that I was able to see the desirable outcomes. And I know everyone's like, "Oh, yeah, that's simple, do the SMART goals," but it still doesn't apply. And then in addition to that plan, I encourage people to invest in coaching. When people come to NP Student and they invest in our books and our magazine, and they also tune into the also complimentary resources, all of those, because they're investing their time, right? All of that is a form of coaching to help you address those blind spots. We're going to be asking some of those questions, those blind spots. And when you address those blind spots, you become a better leader. It's the same way with driving.
I would say truly driving is a great metaphor to this, because you have to assume, even the blind spots, if you don't know what they are yet, you have to assume that there's something there. When you're driving, when you're changing lanes, I always assume there may be a car there. I may not see it right away, but I have to assume, because if not, it's that one time that if you change that lane can wind up in an accident. It's an accident that you don't want to be in, but it's because you decided not to acknowledge that you have a blind spot.
Absolutely.
Talk to me about continuous learning. You've got a number of pathways to showing and demonstrating, again, with the books, with the curriculum, with your online, which is amazing as well, the platform, and being the nation's first platform dedicated to this. You are trying to meet people wherever they are, depending on where they're getting their information. And I am excited to know that eventually, I'm going to say it, is that eventually you also have a podcast that will be coming out. And I'm looking forward to hearing more about that too when it does come.
Yes, that is correct. We have a podcast that's called Navigating NP Practice with Dr. Patrice. And I figured that it's finally time for people to hear more of what I have to say and see the personality behind the business. Oftentimes, when they see the business part, it seems a little, for the generation that I'm serving is what I'm particularly addressing, the millennials and the Gen Zers, it may seem very intimidating because of the different accolades that I have, right? But the podcast, I feel, is the great piece or missing piece for them to better engage with me. So the episodes are very short, I would say no more than 30 minutes long. And the way the format of the show is phenomenal. And so we will have the thought of the week. There will always be a thought of a week. We will have, of course, the whole topic. I'm going to push what the podcast is about, that particular topic. And then we'll finish off with an Ask Dr. Patrice segment. So, because one of the things is, even with the podcast and even with the books, sometimes it's just not enough. And people have these burning questions that they're like, I really need to know if I enter practice. For instance, the most common one that I receive is about contracts. And I'm not an attorney. So one of the things is I'm always referring them to get legal advice, because I'm not giving it, but I'm giving practical advice. And my practical advice is always like, look, it doesn't matter if you cannot afford that attorney. You need to look into prepaid legal, because that's a great service to have for anyone in general, and have them review that contract. Never sign it. Never sign any contract unless it's reviewed. So it allows me to give some anecdotes, share anecdotes, because I have a whole bunch of stories. So that could further resonate with them of why that these things are so serious. And the gravity of the situation is that people are entering these professions blindly, sometimes for a different motive. And when things don't pan out the way they expected, they become very disappointed. And let's address that. Let's be more proactive. Like, I believe it's, is it Stephen Covey? Start with the end in mind.
Yes.
I'm
Yes.
excited about that.
Yes. Which segues right into my next question is, what are you reading and what are you watching, since you're developing curriculum and creating content, but what are you reading and watching?
Oh, I am reading this amazing book called, I believe it's like the 12-week year. It's
That,
the 12-week year by Brian P. Moran and Michael Lemonton. And it's get more done in 12 weeks than others do in 12 months, which I feel I could always revisit what you mentioned earlier. Like, how do you get everything done? And I'm like, well, part of it is that, number one, you don't do everything. And that part I got from TD Jakes, because he mentioned something about how everyone said everything he does seems to turn out well. And he's like, because I don't touch everything. I'm like, that's what I'm talking about. I don't, that's the thing. I don't do everything. So it's interesting, because I've had people say, man, you never come out. You don't come to the conferences. You don't go here. You don't go there. And it's not that I don't want to. There's an appointed time for doing that. And I actually do go to things. I may not showcase it on social media, but I don't go to everything. There's no way I could have built this platform if my brain was scattered and I was always here, always there, listening to this, doing that. And so to bring it back to the whole book, the 12-week year, and why I'm reading it, because I wanted to refine on how I can get more done more effectively in a shorter amount of time, so I could still be the mommy Patrice. It's not a Dr. Little with them, right? It's the mommy when it comes to your family. It's the Patrice. And so I had to figure out how to be able to organize my life better, to do that, to show up better for myself as well as everyone else.
Oh, that sounds like a great book. I'm thinking to myself that if you could get so much done in 12 weeks, if you really utilize time, and how much free time you can have, although it sounds like you would still fill your free time with something that you'd be passionate about doing.
I like to fill my free time with listening to music and like ice skating, roller skating. At the time, of course, this recording, it's around the time where you could ice skate. So yeah, just doing things that have nothing to do with nursing or thinking or curriculums, because you really need that balance. And
Yes.
I talk about that in the starter guide. I mentioned that, like, if it's really the ones who know how to balance and have fun, those are the ones often that you can see most of the success with, because they actually take breaks. You have to take a break. When you take a break, it allows the mind to just reset and your spirit to reset. And then when you go back to it, you're able to be even more creative and laser focused. And that's what it is. So then you can really tap into your genius because you're well rested and you're not stressed.
In coaching, I talk about taking that 20 minutes in the morning, a time of peace, and not actually having someone interrupt you, so that you can think, because and then having fun, having hobbies that have nothing to do with what you're doing day in and day out. It's really important to have that, because it does get your mind, it works the other side of your brain. It gets your mind away from what maybe some hectic or some, work or stress. And so I can't thank you enough for coming on the show and really providing the insights and some resources for those that are leaders, actually, and who might be advising and mentoring others into this particular field in healthcare and being a nurse practitioner. Thank you so much.
Thank you.
And we also appreciate our listeners who are actually sharing the show and talking about the show. We appreciate you. Any type of input or feedback that you would have, please do not hesitate to send us an email at info@mazeassociatesltd.com. Also, too, don't forget, we have the Pen Leader Path that is coming out in March of 2025. Please make sure you get on the wait list at www.mazeassociatesltd.com. And we'd like to thank our sponsor, Edward Jones Financial Advisor, Jennifer Penzition. She can definitely guide you on your path for financial future. So with that said, until next time.
The Pen Leader podcast is hosted by Dr. Shanda Gore and brought to you by Maze & Associates LTD, creating customized solutions for growth in the areas of leadership development, strategic planning, and culture building. Find out more at www.mazeassociatesltd.com. Don't forget to subscribe to the Pen Leader podcast and share with others.